So in just a couple of minutes, I want to transform your thought process when it comes to pelvic biomechanics. Biomechanics tends to be a subject that is taught in school, but then it's not really transferred into the clinic. And I think it's because the way it's presented and the science behind it just makes it difficult. Well, hopefully that's about to change. All I want you to do when it comes to the biomechanics of the pelvis is think of an open or a closed door. Let me explain. So the first thing, open door. An open door represents an internally rotated pelvis. This means that there is space back here. If we want to think anatomically, we have eccentric muscle activity that allows nutation of this sacrum to internally rotate the pelvis. So eccentric, but all you need to think about is space. And that means that we're going to automatically have compression anteriorly, right? So space posteriorly, compression anteriorly. Now, what are these motions? These motions come as a trio. We have internal rotation, adduction, and extension. And when it comes to the sacrum, we already said it is nutating. Now, on the other side, we have a closed door. It's just the opposite. This is an externally rotated position of the pelvis. We have compression posteriorly, which means that we have space anteriorly. And the trio for this is external rotation, abduction, and flexion. And these motions always come together. So now we understand open versus closed doors, but how does that relate to our patients? Well, all of our patients are either going to be better hingers or better squatters. And the biomechanics of the pelvis is what dictates that. Think about it. If you have an open door in front of you, you walk through it. You have the space to push the door open and move through that direction. When it comes to horizontal movement, aka hinges, it requires the pelvis to internally rotate. This is an open door. And because the tissues elongate, it allows that individual to move into that direction. So if you have a patient that has an internally rotated biased position of the pelvis and they are better hingers and they have pain, they probably need to close the door. Why? Because they probably need to increase their movement variability. Now, obviously your assessment and background, everything is from them is going to really determine that. But in general, a general principle would be that to increase movement variability, they probably have a hard time achieving the opposite motion. And in this scenario, that would be closing the door. Now, when it comes to closing the door, these individuals are usually better squatters. Why? Well, think about a locked door. If you went and pushed on a locked door, you would hit the door and then start to go vertical, right? Because the door wouldn't open and you would just slide down. So individuals that are better squatters usually have more externally rotated pelvises. And if they're dealing with pain, they probably need to increase their movement variability. And all this means is that we need to start to open the door. And so that's what we do with exercise. And that's how we can get really intentional with exercise, is when we start to recognize that the biomechanics of the pelvis can really help us determine where we need to go next with our patient to help get them out of pain.